Hi everyone. My name is Otiato Guguyu for GNP Plus. I'm here with the leadership of people living with HIV, very youthful leadership. There's something they say that youth are the leaders of tomorrow. But for this particular case, these are youths being called to be the leaders of now because of the urgency around the disruption and the changes in the structure of HIV funding. So I have very interesting guests from across Africa. I'll let them introduce themselves. So let's start with Jerome.
Hi everyone, my name is Jerome Limo. I am the Executive Director of a youth-led organization based here in Kenya called Ambassador for Youth and Adolescent Reproductive Health Program, that is IREP Kenya. And yeah, I am a leader in the HIV response, extremely passionate about the response being led by young people, and that's why I'm here today. Yeah.
Hi everyone, my name is Noanyaga Gloria. I am the founder and team leader of GILO, Young Positives Foundation, which is a youth-led organization that empowers, equips and educates young people and children living and affected with HIV to improve their livelihoods and well-being. I'm also the Global Alliance Community Champion to ending AIDS in children by 2030 and coordinator for the champions, and also serve on the International Steering Committee of Robert Carr. I'm super excited to be here today for the PLHIV Leadership Summit because I believe the future is young and the future is for children. That is why I advocate for children.
Hi everyone, my name is Oluchi Elizabeth Ndubisi. I'm from Nigeria. I'm a member of Association of Positive Youths Living with HIV and AIDS in Nigeria. I'm also a member of ICW West Africa, Nigerian chapter. And I'm also a member of the World Council of Churches. I work with them from Nigeria. I'm part of the advisory board on HIV and other pandemics. And I am also a peer mentor and a mentor mother because I'm a mother and I have a child who turned out to be negative. I am positive, but my child is negative. So that's how I became a champion to make sure that other children don't get infected. And I'm also a champion of End Pediatric HIV and AIDS in Children EPIC. That's funded by GMP Plus. Thank you.
So yeah, I know it's very, it must be very unsettling when adults in the room, we know what has happened, when adults in the room are making decisions that seem to work against the future of the world generally. And when you get the, I know before we got the global framework to fund HIV, there were very grim stories of HIV. So when you're sort of hearing the adults going around talking about the crisis and what is going to, how much apprehension is it giving you young people? And how are you processing this? So you can start with Jero.
First, I think generally it's the fear of regression. In the summit, we've had our colleagues talk about how it was back then. And of course, most of us were not born, and it was our parents and it was our friends and our relatives, and back then was so bad, people being buried with paper bags. At least that's the context and the situation that was then. And Patricia mentioned that people living with HIV existed even before Global Fund, even before PLHIV, even before all these things we're talking about right now. And it is those resources that have enabled us to get to where we are right now. And sometimes we say it's because of that money that we are alive, today. So for me, and even for the young people I serve and work with and for, is the fear of what if we go back? What if tomorrow I wake up and I'm not able to access that kind of pills? What if tomorrow there's no program, there's no support group, there's no system to continue supporting us because the person who had the tap has decided to close it? So for me, it's the fear of regressing. Yeah.
Yeah. And so tell us about how your network is taking this current US stop order. How are some of your networks coping and reacting to this?
Okay, thank you so much. First of all, I'm from Uganda. I'd forgotten to say I'm from the Pearl of Africa. Yes. So just maybe to add on what she said, on the first question, it's very important for young people to be involved in decision making, meaningfully involved and engaged in decision making. And we have always advocated for nothing for us without us. We as young people, we know our issues, we know our problems, we know how we can solve them, and we can also be part of the solutions because we are the solutions. So it's important for us to add our voices to the decisions that are made, regardless of the fact that probably they have enough experience, the older people, and we actually respect that. We respect the fact that they have more experience, they have more expertise, but it's also very important to hear from our perspectives because the decisions that are making affect us. And it's important for us to be in those decisions and to also, raise our voices towards those decisions and contribute to those policies and decision making. Back to your question, of course, we have all been affected. All the networks in our region, not only in Uganda, but in Africa at large and worldwide at large, we have been affected. For example, in Uganda, we have been having the art clinics. Because of the freeze, we no longer have the art clinics. And of course, these art clinics have been creating a safe space for people living with HIV. We had youth corners for young people living with HIV. We had safe spaces where they could go, interact, share experiences, have psychosocial support. We had funding for follow-ups. We had funding for linkages. All that is gone now. Now they're prioritizing integration, which is okay. We're not against integration, but the problem is there planned integration? Is there integration that is going to be considerate and very safe for people living with HIV? Because we are not used to the general system of OPD, and now people living with HIV are being taken to the general health services. We have to navigate through that system. We don't know the system. And also the people who are there, the health workers who are there, probably don't know how to deal with people living with HIV. We are special in our way. The fact that we are living with HIV, we are special in our way. I wouldn't want to say that we are vulnerable, because we are over that. We are over that. We are creating change. We are frontlining decisions. We are, at the global level, creating influence and all that. But we are special in our way, and we need special care, special attention. So we have been affected that we don't have that safe space anymore. And most of our governments in Uganda, for example, in Uganda, they've not taken the initiative to train the health workers on how they can treat people living with HIV, on how they can prioritize the needs of people living with HIV. So that is going to result to the increased stigma and discrimination. It's going to result to the non-adherence, because people will fear to go and take the medication because the general public will see them. People will fear to go and take the medication because they fear that people will see them and start stigmatizing them. And what is the end result? Is for them not taking medication, and will be going back to the former lives we're in, the former, the steps we had already taken, which is, overcoming non-adherence, achieving viral load, achieving the 90-90-90, 95-95-95. So we have really been affected, and I really hope the US government, PEPFAR and USAID, can reconsider and at least have that funding again for these services to go on, because we really need them.
Yeah, I'll come back to that thought, because it's very interesting, because we really need to process how the challenges of shifting back to general healthcare. So for Elizabeth, we were having a conversation even as we are starting this conversation about the way the numbers were regressing even before this top order in Nigeria. So could you tell us just about the experience in Nigeria and what could be behind this the resurgence in the numbers?
Well, we on our part, we have done so much to make sure that these numbers go down, but unfortunately it's going up. And for me, I think the community has to lead with the awareness campaigns and the rest of them. When we had fundings, we made sure we went into the communities to talk to these women, because the women are the ones who give birth. So we care for the women, and then they care for their unborn babies. But now that the funds have been cut, I don't know how far we are going to go with that. But I'm hoping that we will continue with our initiatives, and we will also come up with new ideas on how to navigate through the whole prevention thing, because PMTCT is a very important aspect when it comes to people living with HIV. We don't want to keep having generations of children who are being born with HIV. It's very difficult. I know how difficult it is to raise a child living with HIV, and I know the stress on the mother and also the child. So it's something we are really working on, and I really hope that the global community would really prioritize, we still prioritize children, women and children, in regards to HIV response and the rest of them, because it's very, very alarming that in this world, in this age and time, there is high prevalence. It's really alarming, and it is scary. It scares me because I want to have more kids. I have one and she's 5, but I want to have more children, and I want to have safe children who are not who wouldn't have to go through the pain and the stress that I went through as a child, because it's not easy. So I'm just thinking, we are actually thinking of ways to be able to curb this HIV, and pediatric HIV needs to end. And we are really working, we're making efforts, but I don't know what happened. But somehow I'm hoping that we will be able to figure things out very soon. I can't really say much on that, because I mean, you just see the cases. I work at the community level. I'm a mentor mother at the community level. So we just see these cases and we are also wondering, but we are doing our best. We are really trying. We're doing our best.
Just a little follow up on that. Do you think the messaging around prevention hasn't really been caught up, has sort of been lost in translation over time, and as an entry point for people living with HIV, as the you to you, that messaging, do you think it hasn't necessarily been brought out the best way that it should be?
Well, it has. I'm in the field, so I know that we have done our part. But the thing is, sometimes, these parents, you can only tell them what to do. You can teach them, but you don't live with them. There was a time when we gave out at the facility, we gave formula for mothers who we felt, when you look at them and the ones who are not really going to keep up with the exclusive breastfeeding thing. Yes. So we give them formula, and even with the formula, the children fall sick. They come up with diarrhea, dysentery, because of hygiene. You don't live in their homes. You can't give them the formula and go to their houses to prepare these things. So we teach them hygiene. We teach them how to make the formula. We teach them how to keep clean, to prevent diarrhea, dysentery, and other stomach infections, but they still come up with these ones. So it's actually very difficult. We are all humans. So it's actually very difficult to tell someone what to do and make sure that they do it when you're not there to monitor and supervise. We can only do that, check up on them when they come to the facility. We also came up with an initiative to even visit them in their homes. I did that. I went to their homes, checked up on them, and when they see you, they are, cooperating. But when you go, you don't know what happens behind the scene. So it's actually very difficult. And then for these women, some of them have, because some of them are in the rural areas, like deep in the villages, and they don't really know what you're talking about when you say hygiene, wash your hands, sanitize, and all that. They have been living like that, so that's the kind of life that they know. So you can't just come up and then they'll just look at you and be like, you just want to turn us to Oyibo. That's how we say it in my place. Oyibo means the white people, yeah. You just want to turn us to Oyibo. We are not Oyibo. This is how we live our lives. They tell you this. And I mean, what else can you do? We just have to keep talking and keep doing our best. And we just hope that these women actually, help us, because we actually need them to help us to be able to achieve this. And then we had a case of a woman who had 2 sons. She died. She died eventually, leaving her 2 sons with their grandmother. We gave her the Septrin, we gave her the Nevirapine, we did everything, but she wasn't giving them this medication. We will give, and she was, oh, they are doing fine, they're all right. She comes with them, and then we see, most times we didn't even notice they were sick. And then before you know it, they had advanced HIV diseases. And they've actually come up with 8, the 2 babies, the 2 boys. One is 5 and the other one is 8. And they're now, it's a full-blown AIDS case now. And she's dead. So the grandmother, you don't expect, it's been very, very difficult for us. So we do our best. We make sure they get what they need, but it still isn't working. And now that the funds are being slashed, or cut off completely, we just pray. We can only pray and hope and keep pushing. That's just it.
Yeah. In just in that line, Cherop, you know that the people living with HIV/AIDS need more like not necessarily just straight up treatment, and as we look at integrating HIV treatment into the general health care, what are some of the anxieties and apprehensions you are having going to get treatment for somebody who does not understand, like she has said, it's not just necessarily just coming for being tested and getting dispensation, because there are things that are involved. Yeah.
One, maybe even for context,
Yes.
is that integration was a conversation that was there before. We, as countries, as African countries, we all knew it would come a time like this where these guys would pack their bags and go back home. We all knew. And even I remember we kept on having conversations around sustainability. But it was meant to be a process. It was not meant to be overnight. You know, we sleep with money, we wake up, we are all broke. It was not meant to be that. And now that pushed our governments to wake up and say, we're integrating. Again, integration was supposed to be a process. It wasn't supposed to be a reaction, but now it became a reaction because everyone is trying to figure out, what do we do? Over 44,000 clinicians here in Kenya had gone home, and some of them have not come back. So you can imagine, you are used to Dr. Anne as a young person. Dr. Anne, when you enter that gate, you see your watchman, you enter. At the reception, you meet Anne, the receptionist. Anne takes your NUPI and writes it down. You know you're going to see either Dr. John, you know, someone you have built a relationship with, someone who's seen you even probably for the last 14 years. So you can imagine how strong this bond is. And when you go into that room, you're free to talk to Dr. John. You're free to say, you know, I have a boyfriend. I'm feeling bad. Actually, at some point, I didn't take my pills. I skipped. There is that relation. But all of a sudden, one day you're coming into the facility and this whole system is gone. There's no Anne, there's no Dr. John. Now it's a new face. It's a new system where you have to wait for hours. And remember, the other side, you are being fast-tracked. You know, here you have to wait for hours. Here, the receptionist, the person from the charge, you just come and shout your name. You are scared. Will they say, you know, in Kenya, in Kiswahili, we say, mtu wa ukimwi, you know, a person with HIV. You're scared. You don't know what this new system is. Nobody is there to guide you, because on the other side, you had Jerop, your peer educator, to support you, to talk to you, to guide you through that system. But this side, you're all alone. And as a young person, you're with older people. You're with your mother, you're with your auntie. You can imagine how that system feels new. And I constantly say that HIV response and even services is very personal. It's a very personal journey. To many people, it seems, you know, people nowadays say HIV is no longer a serious thing, but it's still a very serious thing for us in this journey, right? So one of the biggest fears right now is, how will young people navigate this new system? There's no one, there's no John. It's completely new people. And the worst part of it all is that these new people are not as informed as Anne and Dr. John were. They're not as empowered. They've never even done HIV service delivery. Probably they don't know what kindness or how to create a rapport with a young person is. Probably they behave and make choices like mothers. You know, I might tell that person I want a contraception and they tell me, you're supposed to be in school. You're not supposed to be with boys and having sex. So ideally, it's a completely new system. And for young people, this is a make or break season. If we do not transition and provide a proper support system for our young people, we will lose them. They'll stop taking medication they already have. Actually, here we're already recording cases of young people taking medicine today, skipping tomorrow because they are afraid it will end and nobody else will give them medicine. So they are skipping so that it lasts longer. We already have young people who are going to the clinic. When they see they have stayed for so long, they decide to leave, right? We're having some facilities asking for some money, small money for that process. these young people were not used to giving money. Probably your parent was just giving you transport. You don't have extra money. What does that mean? So for me and for many young people, not just in Kenya, but regionally and globally, it's the fear of what this new system will be and what it will mean to us if it is not done properly. And that's why being part of this leadership summit is extremely important, because we want to ensure that we define what integration will be, will look like, will need for it to actually work for young people. Yeah.
Yeah, it's especially very interesting because once when you're in this space where you get to interact with leaders from other networks and across the world, what are some of the ideas that you're looking at in terms of how should the transition look like? So you can tell us what from the whole summit. Are there some of the things that you think that should be in the transition as we move towards 2030?
Yes, thank you so much. There are so many things that we can really adopt in this transition of integration. And one of the things, I'm going to mention like 3 or 4. One of the things is making sure that those peer educators that were in the art clinics are being taken up by the government, because they're experienced. They know the needs of young people. They know how to treat young people. They should be taken up and also be facilitated, not just being, for lack of a better word, being used, because of their expertise and also their vulnerabilities. It's so sad, just like I said, I want to repeat myself. These people in the OPD, they don't know how to handle people living with HIV. They don't know their needs. They don't know their problems, But these people, the people in the art clinic, the peer educators, they were experienced. How about the government adopts them? And give them a permanent position, even if it's not, very, very much high paid, because still, even when they were in the art clinic, they were given small money, but because they had passion, because they loved what they do, they would go and do the work, So let them be adopted by governments and let them continue with the service they are doing. Number 2, capacity building for health workers in the OPD, in the general services, the health services. These health workers in the general services, just like I said, they are not experienced on how to handle people living with HIV. First of all, they're also overwhelmed with the high numbers of patients. Imagine one health worker handling over 100 patients per day. That was before the integration. Now there is integration. In Uganda, I have 1.4 million people. You get. If we have like maybe 100 people living with HIV coming to a facility every day, those are 200 per one head. Do you think they really have time to give the special attention to people living? No. So they should capacitate them and be able to get the expertise they need to handle people living with HIV. But also they need to increase the human resource. You get, because I don't know about other countries, but in Uganda, nurses and health workers keep on complaining because of the high burdens, because of the so many patients. And now because of the integration, they've added new patients to them and they've not increased the numbers. What do you expect? You get. So number 3 is to make sure that they increase the human resource for the health workers. Number 4, if governments are going to make sure that they're going to successfully implement the integration, they have to make sure that they include the communities. And who are the communities? The people living with HIV. The young people living with HIV, the women living with HIV. We should be included in the decision making, in the designing of the integration, but also in the implementation. We need our voices to be in the decision making. Please don't decide for us. We have voices. We are educated. We know what we want, and we are the ones living with HIV. Most of those people in governments, they don't even know what it means to take medication every day. Why would they decide for us? We need to be on those tables because our voices matter, our voices count, and we know what we want best.
which brings me to the point on where UNAIDS and the global funds are sort of trying to figure out what happens to the HIV intervention post 2030, which is an conversation about the long term. And some of the decision makers are like my father's age, like I said, who won't be there even during that time. How important is it for young people to be in this conversation, especially the posterity one?
Yeah, it's very important. Before we used to say that young people are the leaders of tomorrow, young people are the future. But I want to say that young people are the present because we are here now. We are here now, and this is our time. We are in our prime, and this is our time. This is when we have the opportunity to be able to speak as young people. In the next 10 years, I won't be in this category. I will have someone else I'm probably maybe grooming or mentoring to be like me now. So this is the time when I need to be where I need to be. I need to be part of things that affects me. I need to be able to make decisions. I need to be able to sit. I need a seat at the table to be able to table the actual problems that I am facing, because I am the one who is facing the problem. I cannot speak for I cannot speak for the older people because they know what they're going through. They are old, and excuse me, when you talk about their age range, they have better ideas and better experiences. There was a time when we had this program. It was a workshop in my country, in Nigeria, and we were separated: young people, older women, and maybe younger women. And we were given work to do. And I saw this elderly woman just walk up to our table and give us a paper and say, "Young people, this is what you have to say." I squeezed it and I put it in the trash. You can't, you, we're, we've been grouped. You don't do that. We are young people, we were brainstorming, bringing up ideas, and you just came up from your own old people's table and elderly people's table, and you're giving me a paper, a list of what I should say. I am the one wearing the shoes. I know where it pinches. I should be able, if I don't know my problems, I won't be able to find solution. If I don't tell you what's bothering me, you won't be able to, counsel me or tell me what to do. I can't go to the hospital and my head is aching and I'll tell you it's my leg. You will give me something to relieve pain from my leg, not my head. So I should be able to have that opportunity always as a young person. Someone once asked you, you're always saying, let the young people lead when it comes to young people's matters, but I don't think you people are ready. How can I be ready if you don't carry me along? I cannot be ready if you don't let me in. I cannot be ready if you don't allow me to come in and maybe learn. First of all, I need to learn. I need to be aware. I need to have ideas on what to do on leadership and every other aspect. You can't tell me you're not ready. How am I supposed to be ready when I want to walk into the room and you tell me, oh no, wait, when we're ready for you, we'll call you? It's not proper. So with this integration, I just feel that the young people's session in the facility is still very important. Young people's part in the community is very important, because I have seen where youth-friendly facilities have done wonders for young people. We have them. We have the snooker games. We have the chess. We have the what is it called? The Ludo games in our session at the facility. And when we come, we're not just coming to pick up our medications and disappear. We come, we interact. We are always, trying to catch up with one another. And through the games and all, we catch up. We share ideas, and we look forward to when next we're coming to the facility. It is always fun. So I think we shouldn't leave that out. And like I said yesterday, let the community lead should not be something we just carry on our bodies, on t-shirts and on placards and march on the streets, make noise about it once or twice and that's it. No, we should actually put it in practice. The community should be fully involved. We shouldn't just, say we're handing everything over to the government because of the integration and then we leave the basics. The community is the basics. The community is where it starts. We have lots of young people in the community that we've reached out to, and they're helping us. They are the ones helping us to give the awareness, to intimate people on issues around HIV. We have a lot of them. We have them just waking up and then doing this online campaign on their own. They're not being given money. They're not being given data or internet. They're just there because they've been informed, because they are aware, and because they love it. I have a lot of people I'll tell, do you know I'm HIV positive? And they'll be like, oh, you don't look it. So you can be HIV positive and be this smart and be this good. Like, a lot of people will be like, oh, I just like you because you can. So many of them who are also HIV positive will be like, oh, you're HIV positive? And I'll be like, I know, don't worry, I understand. And they'll be like, okay, this makes me feel better. It makes me feel free to actually come out. And then they have become champions overnight, and they are very happy doing this. The positives, the negatives, we're all coming together. So I just hope that the integration is not something that will just, wipe out all the efforts that we've made from over the years. Because the truth is, whether we like it or not, we are clamoring, let's end AIDS, let's end HIV. It's not going away anytime soon. It's going to take a while. And we need to continue with our awareness, with the informations, and with the care, and with the support and everything for young people. Because young people are the ones who are more vulnerable with the risky behaviors and and all that. So we still have to put a lot of efforts on young people.
Yes. And yeah, so to bring this conversation to a sort of a close, I know it's also you find yourself in a very unique position where you are young and you are leaders of something very important. So I just wanted to draw lessons from you of how you have experienced this leadership. Some of the some of the leaders that have sort of inspired you, or lessons that you've gotten it. So just like a take from each on how leadership has sort of defined you as a person. So we can start with this.
So one, the experience is not smooth. I'll tell you for free, it is not smooth. And I remember when I was starting off in this space almost 8 years ago. Hey, you are so broke and you're in a meeting and you don't even know how you'll go back home. And at that particular time, there was no conversation around, transport reimbursement. How do you support young people to be in this space? You went to that meeting, you met the agenda there, so you're trying to catch up. It has been difficult, to be honest. It has been difficult. But one of the things I really appreciate is how our young people led movement has grown in country, regionally, and even globally. And we've gotten to a level where we have people we look up to, but also people who have held our hands, and they ensure that we are in every room. I think one of the biggest weapon as young people that we have sort of galvanized ourselves is capacity. We are reading books, we know the policies, we know the strategy. We have given ourselves the skills and the knowledge so that when I sit in a room with UNITAID and UNAIDS, I speak like them. So don't just look at me as a young person, but look at me as an expert. Actually, nowadays, we don't say we are beneficiaries. We don't say we are people. We say we are experts. We are equal to task. And to be honest, sometimes we're even better than those doctors, guys with PhDs, because the experience plus skills, you bring everything that is required to the table. And now we have organized ourselves systematically. The same way as people living with HIV, we have the global network of people living with HIV. We also have the global network of young people living with HIV, which is Y Plus Global. And under Y Plus Global, we have the youth movement, where the United Movement for Young People in Eastern and Southern Africa. And we constantly really bring all of us together to capacity build each other, to continue championing for each other, but to ensure that our voices are in every room, whether it's the UN meeting in New York, whether it's the AIDS conference in Germany, wherever we need young people's voices. And I would really rate the experience 8 out of 10. We are not yet there because, sometimes our needs and our voices are taken for granted, or rather they are shoved outside. We're still figuring out how to be in rooms, not just for photo. Sometimes we're engaged and people will take photos and say they were young people. But, our voices were actually not taken into account. We were not treated as other people. And we have these experiences where I go to a meeting, I'm a young person, and there's someone from the government and there's a partner, and I'm given $10, then they are given $100. And I'm like, what is this scale? Why are you, because, you know, I'm a young person, then you're not able to fight for yourself. So you're treated as a lesser person. But those are some of the things we're working on. Those are some of the things we're advocating for. And I'm so grateful for partners like GNP, Y Plus Global, NEFAC, that really ensure that the voices of young people are heard, but we're also meaningfully and ethically treated when we're in these spaces. And they also support us and resource us to participate in these spaces because they require money. And sometimes we don't have the money. And so far, so good. But the movement has really, really grown, and we continue to hold each other in country, out of the country. And when we meet, the agenda is one. If this one is speaking in this room, we are all going to go there and cheer and support. And that is what I love about the movement of young people. Yeah.
Well, I think she said it all, to be honest. No, it's okay. It's okay. You know, young people can really resonate with each other because we sometimes go through the same things. And I can also attest to what she said. The journey is not easy. The journey is not easy. Personally, to share my experience, I started my advocacy in 2018. I was just 22 years, just joined campus, don't know anything about HIV, don't know anything about the space. I went for a pageant called the White Plus Beauty Pageant. Of course, going there, I was facing stigma and discrimination. That is why I went. It's a long story, though. I'll not go there. But when I went into this space and I won the pageant, I became the Miss Y Plus. I started representing young people at the national level, you know, representing their voices and also advocating for meaningful engagement of young people. I got a lot of backlash. A lot of backlash, as if I was a threat. Oh my God, it was not easy. It was not easy. But because of the passion and resilience I had, and I still have, I've managed to thrive. I've managed to thrive, and I'm happy that I'm mentoring so many young people out there to come up and, you know, stand and have the voice and be strong and be resilient and stand for what we deserve as young people. Because it's never easy. It's never easy. This, sorry to say, but the older people see young people as a threat. They see them as people who are going to take on probably their roles, take on their jobs, take on their whatevers you get. Yes, so they would really want to do anything to, you know, either suppress you or shut you down or do anything. But please remain strong. For those who are going to that phase, but even right now, we're still going to that phase, you know, we're still going to that phase, but please don't give up. Be resilient, have focus, be determined, and be purposeful. And you know, one day you will win. One day we will win. And to be honest, I'm also happy that the movement of young people has grown. And I'm also very grateful to the organizations that have really supported us as young people. The Y Plus, Global Young People, people living with HIV, Global Network of Young People Living with HIV, the Global Network of People Living with HIV, GNP Plus. In Uganda, we have the Uganda Network of Young People Living with HIV. For me, in Uganda AIDS Commission has really been supportive among so many different committees at the national level. Even our Ministry of Health has. Yes, I'm really grateful, and I'm just maybe to mention one name. I'm so much grateful to Florence Anand for the co-executive director of GNP Plus. She has always, you know, looted for young people. She has always supported young people. She has always, you know, given us the space, given us the platform. You know, even when she sees you and that you're still, you know, struggling somewhere, she'll push you. You know, she'll give you the platform. She'll give you the space. She'll mentor you. She'll tell you what to do because she has also been there before, you know. So I'm grateful to everyone. And I know one day we will win as young people. We'll be able to achieve our goals and we'll be able to end AIDS and HIV among young people and have a generation free from HIV.
Yes.
Okay, so it's quite relatable. And just like I said earlier, there was a time when I asked for a chance, and an elder in the space said, young people are always saying they want a chance and they want a seat at the table, but you don't look ready. They tell you don't look ready because they want to remain there. They don't want to take that chances. They are enjoying themselves. You know, HIV is not just about the virus and the medication. It is governance. There's a lot in HIV sector. Yeah. There's a lot that's going on in the community. And these people know very well that they are enjoying whatever access they have. Imagine an elder who is signatory to an account with a lot of money. He wouldn't want to let go for someone like me. He will tell you, I've worked for this. I need to reap it. He rather leaves it empty for you to come and still work. But it is not supposed to be a fight amongst ourselves. It is not supposed to be a fight amongst different networks, different organizations, and different groups. We're all fighting one cause. And as a young person, I am going to keep fighting. I will keep fighting. I remember when the only role I had to play as a young person from 2017 that I joined the movement. I didn't know there was a community, but thank God to a friend. Her name is Jonathan Ayuba. And she introduced me to the community. And she was like, there's a place where you can actually feel like you belong somewhere. It is safe. Before then, I would just walk into a facility, pick up drugs, but then I felt welcomed because there was already a structure for me to come into. And that structure was already working because it was about young people, Association of Positive Youths Living with HIV/AIDS in Nigeria. And then I joined the movement. The only role I had back then was just join them in a walk or a march with my t-shirt and my face cap. That's when you get one. And then you have snacks and water while you're marching and clamoring with your placards and your signs and all that. And then after that, we'll just get maybe a transport reimbursement that just takes you back to your home. And then you're just there waiting for the next time. But I had quite a lot of mentors, which is very good. And that was how I started learning. I learned a lot. I grew in this space. I gained experiences and I was able to, stand publicly to speak and also speak to my colleagues, my fellow young people. And then there was this day in Nigeria, there was this program. And then Gracia, Gracia, Violetta Ross. Yes, Gracia was there in the program. And I stood up to say something about young women. And one of the reverends, it was a faith-based program. One of the reverends stood up and gave a sign to another lady, and she stood up and they wanted to shut me up. And Gracia was like, no, let her speak. And that was it for me. You don't shut young people up, especially young women. You don't tell them to keep quiet. They have a lot to say. We have a lot to say. I still have a lot to say. When I find myself in any room, I still have loads and loads of things to say because I have experienced a lot of things as a young person first, and then as a young woman and as a young mother of a toddler. So I have lots of experiences. So from that day on, she would just call me up, check up on me, tell me you need to do this. This is what you have to do. She's been an amazing mentor, an amazing friend. She's always been there for me. So she's the reason why I'm even attending global meetings and all, because I didn't have that opportunity back then before I met her. So we need mentors like that for young people. She's always particular about young people, and that's something I've learned, and that's something I'm going to leave behind. As I get older, I know I'm not going to be young forever, but before I leave this age range, I'm going to make sure that I have young people who have come under me, who have, also had to undergo some trainings and some mentorship. I'm going to have lots of mentees. That's the dream that I have for young people living with HIV and AIDS. And we just hope that we can be able to curb and possibly end HIV and AIDS in the very shortest time. I don't know when and I don't know how, but we are being hopeful. And we are just hoping that the integration will not affect young people so much because we don't need it to. we've been through a lot already. We've had our own fair share of the bittersweet part of being HIV positive, and we don't want any more. Like, this is fine by me already, and I don't want it for young people coming up. So I just hope that we'll be able to end the whole HIV/AIDS pandemic very, very soon.
Can I just say one thing, especially on the role of young people living with HIV as leaders in the response? Sometimes when we say we want the space, adults and older people assume we're saying, you guys leave so that we take on the mantle. No, we're not saying that. Actually, adult and youth partnership is extremely important.
Yes.
They've been here. All of us have been held hands, and we are mentored, and we're still being continued to be mentored by adults and older people who have expertise in this space. So we just want an environment where you're willing to learn from us. We are willing to learn from you. And if the space is young person below the ages of 30, if you're 31, step aside. Allow the one who is 30 and below to sit in that space, because we are now wearing the shoe. We know you passed that age. We do not disagree, but contexts are a bit, different. These generations are also a bit different. So we are also championing for adult and youth partnerships. But we will also complain when adults do us dirty. We will hold you accountable, but at the same time, we'll give you the respect. We still need your guidance. We need you in the room, because it's very, very important. Yeah.
Yeah. As you can see, there's a lot to say. These young people have a lot to say about this, the HIV movement, but we'll have to leave it at that. I've been joined by these very beautiful ladies who have given me a lot of insights into the transition of the HIV movement beyond 2030. I was your host, Otieto Guguyu, and thank you for having us.
Bye.
Bye.